We're here today to communicate about a healthcare worker who has contracted the Ebola virus. That healthcare worker is a heroic person who provided care to Mr. Duncan. I met with that healthcare worker's parents, and the healthcare worker and their parents have asked that their privacy be respected and their name not be released at this time. We expected that something, that it was possible that a second person could contract the virus. Contingency plans were put into place, and the hospital will discuss the way that the healthcare worker followed those contingency plans, which will make our jobs in monitoring and containment much easier in this case than in the last one. I want to stress before we bring up a doctor a very important fact. You cannot contract Ebola other than from the bodily fluids of a symptomatic Ebola victim. You cannot contract Ebola by walking by people in the street or by being around contacts who are not symptomatic. There is nothing about this case that changes that basic premise of science, and so it's important that while this is obviously bad news, it is not news that should bring about panic.
Late last Saturday evening, a preliminary blood test on a caregiver at Texas Health Presbyterian Hospital, Dallas, proved positive for Ebola. This healthcare worker had been under the self-monitoring regimen prescribed by the CDC, and based on involvement in caring for the patient, Thomas Eric Duncan, during his care that started on September 28th. Now, individuals who are being monitored are required to take their temperatures twice daily, and as a result of that process, the caregiver notified the hospital of imminent arrival and was immediately admitted to the hospital's isolation room. The entire process, from the patient's self-monitoring to the admission into isolation, took less than 90 minutes. The patient's condition is stable. A close contact has also been proactively placed in isolation. The caregiver and the family, as already stated, have requested total privacy, so we can't discuss any further details of the situation. As the judge mentioned, we've known that further cases of Ebola are a possibility among those who were in contact with Mr. Duncan before he passed away last week. The system of monitoring, quarantine, and isolation was established to protect those who cared for Mr. Duncan, as well as the community at large, by identifying any potential Ebola cases as early as possible and getting those individuals into treatment immediately. Finally, we have put the emergency department at Presbyterian on diversion until further notice because of limitations in staffed capacity. That means ambulances are not currently bringing patients to our emergency department. While we are on emergency department diversion, however, we continue to fully care for all of our patients, and we are also using this time to further expand the margin of safety by triple checking our full compliance with the updated CDC guidelines. We are also continuing to monitor all staff who had some relation to Mr. Duncan's care, even if they are not assumed to be at significant risk of infection. All of these steps are being taken so the public and our own employees can have complete confidence in the safety and integrity of our facilities and the care we provide. Thank you.